Now, coming to the section with the clinical assessment, how are we going to be diagnosing a patient with portal hypertension? What are the clinical features? What are the lab investigations? We'll be talking about that in detail. So, if we talk about the clinical features, one of the main symptoms that we can notice is that there is a gastric variceal bleeding. So, the patient might come to the OPD with symptoms such as hematemesis. He complains that he is vomiting and there is dark blood within the vomitus. And then he could also complain of melena, which he might be saying that whenever he goes for defecation, there is blood within the stool. And then, if we talk about the portal hypertensive gastropathy or the gastrointestinal vascular ectasia, it causes chronic blood loss. So there could be anemia, there could be different sort of pictures such as the pallor of the skin, and that's because of the blood loss that is occurring through the mouth and through the anus. And then variceal bleeding, there could be the recurrent hematemesis. So every time he vomits out, he vomits a lot of blood. So this could also be one of the medical emergencies. A patient could come into the emergency with such a case. So if we talk about the indications of portal hypertension, what are the signs that a doctor could be noticing within the patient? So there could be spider telangiectasis, like I mentioned, but before that, telangiectasia is, to be honest, a vascular lesion that is characterized by dilation of the blood vessels that are just underneath the skin, and it's very superficial, and it usually gives an idea of a web, and that is the reason why it's also called as spider nevi. And then we've got the GI bleeding, which I've mentioned, that variceal bleeding, it could leak and there could be hematemesis. The patient could present with yellowish discoloration of his skin, of his sclera, of his tongue, and this is very noticeable that there is a liver cause. And then there could be some testicular atrophy, palmar erythema, which is the redness of the palms of the hand. And then we've got encephalopathy. A patient might present with confusion, dizziness, and this could also be one of the reasons of portal hypertension. Dupuytren's contracture is also noticed among patients with portal hypertension, but it's slightly rare, and it usually happens in a very severe case of portal hypertension. We've got the parotid enlargement, splenomegaly, loss of secondary sexual characteristics, and lastly, ascites. So ascites is also very important with the combination of splenomegaly. So if in case you see a patient with splenomegaly, it could be a liver cause, and then if you notice a patient having ascites, as long as he has splenomegaly, so this could be a suspicion of varices is very necessary. So if we talk about the different laboratory tests, these tests usually shows a frequency of the loss of the synthetic function of the liver. So the liver function test is very necessary because it usually shows the functions of the liver that is deranged, that is disturbed. So we would notice a prolonged prothrombin time, hypoalbuminemia, which is the decreased albumin, hyperbilirubinemia, it could be the increased bilirubin, and then anemia because of the blood loss from the mouth and the anus, thrombocytopenia, leukopenia, and lastly, bone marrow suppression. Bone marrow suppression is usually among patients who are alcoholic. And if we talk about the thrombocytopenia and leukopenia, it's usually a condition in hypersplenism. So if we talk about the abdominal imaging, what are the things that we would be able to find on a CT report? Splenomegaly will be very, very noticeable. Collateral vessels will be noticeable, abnormal liver ecotexture and contour, and ascites. So this is a picture of a CT scan of the liver, and as you can see that there are choledochal varices that are surrounding the dilated bile duct, and these arrows, they also show that there is a dilation of the bile duct.